at Hello Heart in Atlanta. Thank you so much for joining us this morning about a topic that not a lot of us want to talk about.
That's
because if you haven't had it yet, you're like, I just don't want to talk about it. But why are we seeing more cases, especially since COVID? These are some of the highest numbers that we've seen.
That's right. We had a peak in the summer of COVID, and now we've had this peak of flu in December and January, and we're seeing the second wave. And part of that second wave is predicated on the complications of the flu that occurred in those who got it in December and January. So these bacterial pneumonias, especially in those with heart disease and strokes and any other types of chronic diseases. The other thing is our vaccination rates are still fairly low. We're hanging out around 45%, children as well. And that also protects you and protects your heart.
Yeah, I mean, it is hitting the kids. We're talking about flu cases so high that school districts in 8 states have closed school due to this. But you mentioned, maybe not getting the flu shots as often, right, with the kids.
Right. And, the flu shot is about 50% effective this year. It's never 100%. We look for the variants and then make the best guesstimate.
It's a forecast, right?
It is a forecast. You are familiar with that. And so it's about 50% effective. But what it does do is mitigate the symptoms of the flu and the spread of the flu and helps you to recover more quickly. And we try to avoid these things like school closures.
Okay, avoiding the spread of the flu. That's one of the most key parts. There's actually at-home flu tests now. I mean, we got used to that during COVID, but now we can do that for the flu, I suppose?
We can. And the reason that is particularly effective, sometimes people say, well, I'm going to do an at-home flu test. I'll just, take chicken soup or call my doctor. The point is to confirm if you have the flu, because if you don't, you might have something else. But also, if you get the flu, you have the option within the first 3 or 4 days to be prescribed Tamiflu, especially if your symptoms are more severe or if you have these chronic medical conditions like heart disease, to dampen and mitigate those symptoms, keep you out of the hospital, or get you back on your feet much more quickly.
I heard Kelly make the noise. I think we've all been there where it's like we've been told it's too late to have
right.
So when you're like,
you waited too long.
Yeah.
Women especially. We always wait too long. We're taking care of other things and other people. That's right.
Let's talk briefly about the bird flu, because that's also making headlines too. I mean, it seems to be jumping from animals too. Is that a problem in the farming industry, and could this become a virus that humans catch?
Kelly, such a great question. Definitely keeping an eye on the bird flu, especially with this second resurgence of the flu, the influenza flu, because if someone were to be co-infected, so have the bird flu and the human flu is what I'm going to call it today, just to make it clear, that co-infection actually gives the bird flu an opportunity to adapt and make changes. And therefore, that's when we get into the situation where we have an opportunity to get a pandemic as the bird flu learns from the regular flu when you're co-infected with a patient. So that's actually a worst case scenario, and we're keeping an eye on that.
Well, Dr. Morgan, we've got about 30 seconds left, but what is your best advice? Just run it down the list of how we can avoid the flu for the rest of the season.
Yeah, because we don't want it.
Yeah.
That's right. So best advice, get your flu shot. If you think you're sick, mask yourself and your family. But remember, I'm a cardiologist. This is Heart Health Month. The flu actually increases your risk of having heart attacks and stroke by 6 times. That's because the flu causes inflammation in the body, including in the muscle. The heart is a muscle. You can get inflammation, you can get plaque rupture, and so we see heart attacks increasing.
And that's when we need to see doctors like Dr. Morgan. Yes. Dr. Jane Morgan, thank you so much for coming.
Thanks so much.